So lastly, we're going to look at exercise selection, and it's going to come before progression. And we'll talk about exercise selection, and then we'll come back and talk about progression here a little bit. And then there's the last two parts here are rest periods and tempo. But basically with exercise selection is you're looking to do the more complex, bigger muscle groups, more challenging exercises early in the workout and follow up with more simple or components like more stable exercises. So think of the amount of resources that you have to perform an exercise, and that's finite. And as you start working out, the clock is ticking and you start losing, you're running out of gas. And so you want to do the things that are challenging to you early on, that require more thought of you early on. And then towards the end of the workout, you want to be able to do things that are a little bit more mindless. So power cleans versus walking on a treadmill. Walking on a treadmill or running even is going to be less complex than the Olympic powerlifting that has multiple moving parts to it and lots of intensity. So your book goes through and gives you some examples. But there's kind of a relationship aspect, like power and primary exercises before assistance. So you're not going to do arm curls or leg curls or wrist curls or calf raises or any kind of single joint exercises before you do your compound. So if that joint is being required, so that's kind of these first three here. Actually, all four of these are kind of in that, what I just said, is that if you have smaller components, smaller links of the chain that go to that contribute to the whole, you're not going to pre-fatigue those before you do that. There are some techniques that specifically do that in the sports like bodybuilding, powerlifting, weightlifting, but remember what I said earlier is that sport and fitness are not the same. There's different ways of ordering your exercises too. You can do push-pull like compound sets or supersets where you're doing opposing or similar muscle groups. You can do Fartlek type stuff where you're doing upper and lower, and then you can do metabolic at the same time where you're trying to do some kind of circuit training where you are letting metabolically the upper body recuperate as the lower body is doing it. You're still contributing to central fatigue, but you at least have that peripheral aspect. Rest is the other part here, and that's driven by what zone you're in. So basically, the more reliance on the nervous system, the longer rest periods you're going to have. The more reliant upon the metabolic system, the shorter rest period you're going to have. And if you look at the chart here, you'll see when we look at the outcomes for the acute variables, you have more neurological, this is more tissue, and this is more cellular. That in order to allow the nervous system to completely recuperate, it's going to take 3 to 4 minutes to allow the neurotransmitters to recycle in. And here you're allowing the ATP and the lactate to clear out. Here, you're really just trying to hit more of the endurance aspect, and you can start your next set right away. So the rest period is driven by what outcome you are trying to achieve. So we'll back up a little bit, and then we'll look at progression. And progression means a couple things. And the first thing is that are you continually exposing yourself to things you can't do? Because the name of the game is 1 step back, 2 steps forward. So you're 1 step further than you were before. You're going to have to match now your new metabolic homeostasis, your new strength, your new capability with better resources. So if you work out and all you lift is 150 pounds, that's all you're going to get strong at is 150 pounds. So if 150, 155, 160, 165. If you can do that in the smallest increments as possible, I know we're set with our weights in the gym. Sometimes we have 2.5 where we go from 5, 7.5, 10, those type of things. But if you can do these smaller components, the better. And we'll talk about strategies for that. Part of progression is this concept of variation. And with variation, you have 3 primary aspects that you're looking at. You're looking at mechanical variation, neurological variation, and psychological variation. Now, you don't have 3 things that you're doing. When you vary your workouts by creating built-in variation, so not doing the same thing over and over again, you're hitting all 3 of these outcomes. So when we look at why we change things up, which is about every 6 to 8 weeks. 6 to 8 weeks is about the time where tissues start to adapt. And what we're trying to do when we change things up, and it doesn't have to be dramatic, it just needs to be slight. So you can go from flat bench press to incline bench press. That's enough variation. You can go from close grip to wide grip. You can go from standing to seated. You're doing something different for the environment for the body, and it has to adapt accordingly. Most of these are going to be from their neurological, both conscious and subconscious. But the first thing we'll talk about here is the mechanical. And what happens is when you change things slightly, when you go from a flat to an incline or incline to a decline, or you go from close to a wide grip, you're creating a new biomechanical environment. You're using that joint in a different way. Muscle tissue is muscle tissue, and so whether you're doing an incline press or a decline press, you're stimulating those muscles. So they're getting under tension, they're working. What you are doing differently though is you're putting different pressures on the connective tissue, the joint, the cartilage, and so forth. Muscle has a high capillarization, has high vascularization, so it has a high recuperation rate. So we don't really worry so much about muscles getting overworked. What we are more concerned with is the tissues getting overworked in terms of the supportive connective tissue. So while we're giving this part of the cartilage or drug capsule a break, we're working the other one, muscle's still working. The other thing it does is it increases psychological aspect. It just kind of breaks up the monotony of it. It's a novel experience. And so this gets to that base of the pyramid, which is adherence. You're creating a positive experience and probably a little bit more enjoyment in the exercise. And the last thing you're doing is the neurological, is that you are creating, you're forcing the nervous system to have to recruit in a slightly different way. So before it ended up getting to the point where it was finding a better way of doing things and not needing to add more muscular adaptation, you kind of changed things up a little bit and kept the nervous system on its toes. It's not really muscle confusion. That's the industry slang term that's used for it. But it really is the nervous system having to create being exposed to a novel experience and having to rely on both tissue adaptations as well as neurological adaptations for strength improvement. I know we talked a little bit about this in class. The last thing we'll talk about is this concept of tempo and time under tension. It's at the top of the pyramid because it's not as big as a factor in terms of like adherence and volume and so forth, but it is probably one of the most underutilized and undervalued variables that we can use to manipulate. Now what time under tension is looking at is that when you look at an exercise, you have a starting point, you have an eccentric phase, you have a transition, and then you have a concentric phase. And we take for granted how long we spend in each of these phases. So you have your start, your eccentric, isometric. Now you might start concentrically, eccentrically, but you still have this nonetheless. And what time under tension is the total tension that the muscle is that you're doing for a complete set or complete rep and then thus a complete set. Most people follow like a 2-1-1 or 2-1-2, but if you give some intentionality behind it and you give a number, so let's say you have 2 sets of 12 or 5 sets of 5, and you follow it up with this EIC, this eccentric, isometric, concentric number, so 2-1-3. What this means is I'm spending 2 seconds eccentrically. On the down phase, I have about 1 second transition and 3 seconds concentrically. So my total reps are 6, my total time under tension is 6 seconds per rep. And if I'm doing 10 reps, that's 60 seconds total time under tension. Let's say I manipulate that a little bit and I just add 1 second to my eccentric phase. So instead of taking 2 seconds to descend, I'm doing 3 seconds to descend. I look at 3-1-3, that's 7 seconds per rep. That's 70 seconds for the same 10 rep exercise. So it's 10 more seconds that my muscle tissues have to respond to that force, that external loading. So you can manipulate this in different ways, and if you remember from KIN 230, we talked about the advantages of eccentric versus concentric versus isometric. You can bias each of these phases, and you can take a 3 sets of 10 exercise and manipulate the eccentric, concentric, isometric phase and create a different experience for the patient or client. Sometimes from a physiological benefit, sometimes from a neurological aspect. So other variations of this, you can see like a 1-0-X where you see 1 second on the way down, 0 second transition, and an explosive concentric for 1 second aspect. You can do the opposite direction where you go increase further, 5 second eccentric, or you can do a 1-1-5 where you would have a 5 second concentric and 2 totally different metabolic aspects. So again, overall at the top of that pyramid, but a very powerful aspect to be able to, on the fly, to be able to manipulate the progression. You know, let's say 55-pound dumbbells are too easy, but 60-pound dumbbells are too much of a jump, you could, instead of trying to change weight to increase the progressive overload, you can manipulate the tension or the time under tension. And instead of, let's say they're doing a 2-1-3 on the way there, you can say, instead of doing 2 seconds up, let's do 3 seconds up. Or instead of doing 3 seconds down, let's do 4 seconds down. So on the fly, you can make things harder or easier depending upon the patient's performance at that time. So that's it for program design, and you look at all of these elements together, and the one thing we didn't talk about was the actual exercises themselves. That's because there's infinite options that are there. As long as you're covering those 3 basic things, pushing things away from you, pulling things towards you, or changing your elevation, that's it. Once you got those covered, you can go through your inventory or go online or look through any magazine or book or Instagram post that you want and find the exercises that you need to fill the template you created with your variables here.